Welcome back to Health PathFinders. Today, we're embarking on a compelling journey with John, a 62-year-old man who was diagnosed with prostate cancer. This is a story that unfolds in an ordinary world with John, an ordinary man living life to the fullest. He loves to stay active, relishes a healthy meal, and savors the simple joys of life. Yet, life had an unforeseen journey in store for him. In the midst of his routine life, John began experiencing some troubling symptoms: frequent urination, especially during the night, and a sense of not being able to empty his bladder completely. These were subtle signs, easy to brush off as effects of aging or perhaps just a minor urinary infection. Yet, John didn't ignore these signs. He chose to listen, to pay attention, to not dismiss these changes as insignificant. This is where our story begins. From an average guy living his life, John stepped into the shoes of a health pathfinder, seeking answers, seeking clarity. He made the conscious decision to take these symptoms to his primary care physician, a decision that would change the course of his life. It was here that John's unforeseen journey truly began. A journey that would take him through the maze of medical evaluations, through the uncertainty of diagnosis, and into the reality of living with prostate cancer. This was not a journey he had planned for, not a path he had anticipated, but it was a path he was now on, a journey he had to embark upon. John's journey serves as a potent reminder of the importance of listening to our bodies and seeking medical advice when something feels off. It is a testament to the power of early detection, the strength of informed decision-making, and the resilience of the human spirit. John's story is just beginning, and we invite you to join us as we follow his path, one step at a time. Scene script. John's medical consultation led to a diagnosis that would change his life: prostate cancer. But what did this mean for John? Unpacking this question takes us on a journey through the world of medical diagnostics. The process began with a PSA blood test, which measures the level of prostate-specific antigen in the blood. Higher levels of PSA can indicate the presence of prostate cancer. Adding to the PSA test, John also underwent a digital rectal examination, or DRE. This test allows the doctor to feel for any abnormal bumps or hard areas on the prostate that may suggest the presence of cancer. Upon confirmation of John's diagnosis, the next critical step was staging the cancer, a process that reveals the extent of the disease and the degree to which it has spread. The most common staging system for prostate cancer is the HACC-UICC-TNM system. This system categorizes the cancer based on tumor size, spread to surrounding tissues, lymph node involvement, and metastasis. The stages range from I to IV, with higher stages indicating more advanced cancer. In John's case, the staging process was instrumental in understanding the severity of his condition. It helped his healthcare team to determine the appropriate treatment options and to predict his prognosis. Prostate cancer can be categorized as localized, locally advanced, or metastatic based on its spread. Each of these categories has its own implications for treatment and recovery. In addition to staging, prostate cancer can also be classified into risk groups based on the likelihood of recurrence. These risk groups are determined by factors such as tumor size, PSA level, and a measure known as the Gleason score, which grades the aggressiveness of the cancer. The risk group classification provides further insights that guide treatment decisions. In John's situation, understanding the stage and risk group of his cancer was a crucial part of his journey. It allowed him to make informed decisions about his treatment with the guidance and support of his healthcare team. The staging of John's cancer provided a crucial roadmap for his treatment journey. With a diagnosis in hand, John was faced with a crucial decision: choosing the right treatment. When it comes to prostate cancer, the available options are as diverse as the men they seek to help. Each treatment carries its own unique set of benefits and risks, and it's essential to weigh these factors carefully. Let's take a look at how John and his healthcare team navigated this complex landscape. Firstly, there's active surveillance. For men with lower risk prostate cancer, this approach involves closely monitoring the condition without immediate treatment. This can be a good option for those whose cancer is slow growing and not causing symptoms, but it requires regular checkups to ensure the cancer isn't progressing. Next, we have surgery, specifically a radical prostatectomy. This procedure involves removing the entire prostate gland and some of the tissue around it. It's a common choice for men with localized prostate cancer, but it's not without its risks, including potential impacts on urinary control and sexual function. Radiation therapy is another option. This treatment uses high-energy rays or particles to kill cancer cells. It can be delivered externally or internally through a method known as brachytherapy. While effective, radiation therapy can also have side effects, including fatigue and changes in urinary and bowel habits. Hormone therapy, on the other hand, seeks to lower levels of male hormones, which can help slow the growth of prostate cancer cells. It's often used for cancer that has spread beyond the prostate, but it can also be used in conjunction with radiation therapy for high-risk localized cancers. John, being the proactive individual he is, took time to understand each of these options. He sought second opinions, asked questions, and weighed the potential benefits against the side effects. This process wasn't easy, but it was necessary, and it wasn't a decision he made alone. His healthcare team was there every step of the way, providing information, guidance, and support. John's informed decision-making stands as a testament to the importance of patient involvement in treatment choices. It's a reminder that, while healthcare professionals bring their expertise to the table, the patient's perspective is equally vital. After all, it's their life, their body, and their journey. There, John's surgery was a success, but his journey was far from over. As we delve into the next chapter of John's story, we explore the vital components that make up his post-operative journey: follow-up appointments, ongoing monitoring, and comprehensive care. After his radical prostatectomy, John's first step was to rest and recover, allowing his body to heal from the procedure. This initial period was crucial as it set the stage for his subsequent recovery process. But resting was just the beginning. John's healthcare team scheduled regular follow-up appointments, creating a structured plan to monitor his progress. These appointments served multiple purposes. They kept a close eye on his recovery, ensured that any potential complications were promptly addressed, and most importantly, checked for signs of cancer recurrence. The follow-up appointments were not simply about physical examinations. They were also an opportunity for John's healthcare team to assess his overall well-being, including his mental and emotional health. His doctors understood that dealing with a cancer diagnosis and undergoing treatment could take a toll on a person's mental state. They ensured that John had ample support and resources to help him navigate these challenges. In addition to these regular checkups, John also had to undergo ongoing monitoring. This involved periodic tests to measure his PSA levels, a key indicator of prostate cancer. Regular monitoring allowed his doctors to detect any possible signs of cancer recurrence at the earliest stage, increasing the chances of successful treatment if the cancer did return. John's comprehensive care didn't stop at the hospital doors. He also took proactive steps at home to maintain his health. He continued with a balanced diet, regular exercise, and good sleep habits, all essential components of a healthy lifestyle that could aid in his recovery and overall well-being. Through his diligent post-operative care and monitoring, John was able to keep a close eye on his health and promptly address any concerns. His journey highlights how critical it is for patients to adhere to their follow-up care plan even after successful treatment. John's diligent follow-up care underlines the critical role of continuous monitoring in remaining cancer-free. His story serves as a powerful reminder that the fight against cancer doesn't end with successful treatment. It continues with diligent post-operative care, regular monitoring, and a commitment to maintaining a healthy lifestyle. John's journey through prostate cancer serves as a beacon of hope for many navigating similar paths. As we reflect on John's journey, we see a story of resilience and empowerment. A tale of an average guy who, when faced with a health challenge, took proactive steps to address his concerns. This led him to a diagnosis of prostate cancer, a condition that affects millions of men worldwide. John's story highlights the importance of early detection. His decision to seek help as soon as he experienced troubling symptoms played a crucial role in his treatment journey. Prostate cancer, when detected early, can be managed effectively, improving the chances of a successful outcome. Informed decision-making was another critical aspect of John's journey. Armed with information about his diagnosis and staging, he explored his treatment options alongside his healthcare team. This allowed him to weigh the benefits and risks of each choice, ultimately making a decision that was best suited for his unique situation. John's journey also underscored the significance of comprehensive care. After his successful surgery, the follow-up appointments, monitoring, and ongoing care were vital parts of his recovery. This ensured he stayed healthy and cancer-free. John's story is a testament to the power of resilience, hope, and the human spirit. It's a story that inspires and educates, shedding light on a condition that affects so many. But the journey doesn't end with John. Prostate cancer continues to be a major health concern, and it's up to all of us to raise awareness, promote screenings, and support research efforts to combat this prevalent disease. John's story inspires us all to be proactive about our health, raising awareness and promoting screenings to combat this prevalent disease. Remember, your health journey matters, and you're never alone in it.